Once you understand the anatomy and once you understand what's happening on the entrapment, it's sort of mind-boggling what the common treatment options are. If you were to go to YouTube and you would Google or search on YouTube, thoracic outlet syndrome exercises, the majority of what you would see is neck stretches and scapular stability exercises, specifically kind of like old school scapular stability, being a lot of like posterior scapular work, scapular retraction, like Y's, T's, L's, W's. We don't need exercises to bring us into thoracic extension and bring us into scapular retraction and depression, because that actually creates less space in the retroclavicular space. That narrows it even more. Not to mention that it takes the pec minor and it also stretches it out, which theoretically maybe it is a good thing if the pec minor is tight, but I don't know about you. If something is tight, going to stretch it, especially if there's a space behind it, is just going to make that space even smaller and compress what's underneath even more, right? And so what needs to happen is we need the opposite. We need to get the shoulder blade to move forward on a round rib cage, on a round thorax. And so restoring the thoracic curve is so important. You know, the scapula lives on a curve. The scapula loves a curve. The scapula is more stable when it has a curve to move on. Oftentimes, too, when we restore that flexion and when we restore the mobility of the scapula, we improve breathing mechanics, and then therefore the scalenes also often relax and cause less entrapment at that first space too. Instead of doing things like T's and W's and prone A's or prone swimmers even, I would do closed chain scap push-ups. I would do sideline scapula stretches into upward rotation. I would direct manual therapy to the rhomboids, to the levator scapula, to the mid trap. I would facilitate function of the upper trap, because if we look at our clavicle mobility, we want the clavicle to be elevated and protracted to give more space in that costoclavicular or retroclavicular space. And so I like to start people just on getting to know their clavicle and then learning how it moves, usually guided by what's happening at the SC joint. And that usually often frees up the scapula. Sometimes people's scapulas are so glued to their back though, because they've done so many posterior exercises, that we need to take a step back and free things up from the back. So I might do cupping back there. I might have them roll on yoga tune-up therapy balls. So when you understand the anatomy of the thoracic outlet and possible areas of entrapment, now you see how you need to actually restore a more anterior tilt and a more protracted position, right? Yeah, let's stop doing posterior work for people with thoracic outlet. Let's add in some pushing. Let's add in some scapular mobility. Let's restore a normal position of the scapula.